We are following a developing story on controversy involving chemotherapy. Nearly 1,200 cancer patients in Ontario and New Brunswick may have received doses that were lower than intended. 7 Action News reporter Malcolm Maddox found out that their cancer may not have been targeted as aggressively as it should have been.
Yeah, this is a stunning revelation. We're talking about 2 commonly used chemotherapy drugs that are used in the treatment of breast cancer and lymphoma. They were provided to 4 Ontario hospitals, including one in Windsor, and they had lower than intended doses in them. In essence, the drugs were watered down. According to Cancer Care Ontario, the chemotherapy meds were up to 13% less powerful than they should have been.
The assumption is that up to 1,000 people may have received doses that are less than what was intended.
What's worse is not only were the doses less than intended, but some patients were getting these lower doses for as long as a year. Dr. Carol Salka of Cancer Care Ontario says it's impossible to say how this will affect the cancer and whether it puts the patients in any more danger.
Will they worry? Sure, that's the nature of being human and having a condition. Of course, I think that it's a cause for some worry, but it's the job of the oncologist to discuss with them whether that worry is justified or not.
The drugs came from a supplier who's responsible for mixing and labeling the medication and then providing it to hospitals. The problem was uncovered by a hospital pharmacist in Petersboro who tested the supplier's product. The mistake appears to be the result of failing to maintain the proper saline to medication mix within IV bags prior to shipment. As a result of the mishap, all Ontario hospitals are now mixing their own doses, and the supplier is no longer being used for this medication. The 4 hospitals in Windsor, London, Oshawa, and Petersboro are now arranging a special meeting for the patients and their oncologists. In addition, another hospital in New Brunswick says that it is in the process of notifying nearly 200 patients who were also given the diluted chemotherapy treatments. If you have any questions, you're urged to contact the hospital where you received treatment. Jeff?
Malcolm, thank you.